How long have I been in the field of healthcare?
So that's good.
How long have you been in the field of healthcare?
Since about 1969.
What specific part in healthcare did you work in?
I worked with hospitals, medical groups, and medical device companies.
How has healthcare changed throughout the years?
It's consistently grown as a percentage of GNP from around 5% in 1970 to over 18% in 2014. Hospitals have grown significantly, and the government's role in healthcare has increased dramatically.
Can you explain?
You want more about it?
Yeah.
Well, Medicare was implemented in the early 60s, which was government's first incursion into healthcare along with Medicaid. Medicare was for the elderly, Medicaid was for the poor. And because the government did not want to have people make profits in healthcare, they instituted a program where they would pay providers the lower of cost or charges. So they only wanted to pay costs. When you implement that kind of a program, what happens? Costs go up. So everybody started raising their costs and raising their rates so that the government would pay them more and more money, which was a large part of what caused the increase in explosion in healthcare costs over the last 40 years.
Can you explain why healthcare costs are so high in this country?
Because we have very strong lobbies for the pharmaceutical industry, the insurance industry, the hospital industry, and the physicians, all of whom want to make sure they get their share. And therefore, it's very difficult for the government to pass any legislation that truly reduces costs without a fundamental revolution in the way we pay for health care.
What is the Affordable Care Act, and how does it work to lower the healthcare costs?
The Affordable Care Act is not affordable, and it doesn't act to lower health care costs. What it did is increase access to care for many people, but it left it up to the states to decide whether or not they would individually provide increased Medicaid coverage. So that, for instance, the state of North Carolina, where we live, chose not to participate in creating a health exchange and taking more Medicaid dollars. So despite the Affordable Care Act, we still have over 500,000 people in the state of North Carolina who aren't covered by health care. The two things the Affordable Care Act did not do were institute any limits on costs for insurance, medical devices, hospitals, or doctors. And the other thing it didn't do is institute any limits on the volume of care provided. Nor did it ensure that care from state to state was provided at an equal level and an equal cost. So there are some states in the United States where you can get an appendectomy done for $1,800, and other states it can cost over $150,000. Crazy.
What can be done to improve the Affordable Care Act?
In my view, the only thing that they can do is eliminate individual states' rights and institute a federal program with a single payer system. And if we had a single payer system where everybody paid an equal amount for their health care services, we wouldn't need to have insurance companies, which would save us about $500 billion a year. And we wouldn't need to have the hospitals going through all the rigmarole they do to qualify people for insurance, which would probably save us another $400 or $500 billion a year.
In our country, we spend on average about $8,508 per person. Yet we still are ranked low in quality and accessibility. In your professional opinion, what do you think we could do?
We could readily implement a nationwide program to ensure accessibility. With respect to quality of care, part of what we have to do is implement programs that put some responsibility on the individual for their own personal health, so that if someone chose only to eat pasta and pizza and grew up to become a diabetic because they didn't have a balanced diet, the government shouldn't have to pay for that. Or if somebody smoked 6 packs of cigarettes a day and got lung cancer, they should have some responsibility for that, as opposed to leaving it all to the providers and doctors. We all want a silver bullet that we can take that's going to cure us of all our ills, but none of us want to take responsibility for staying in shape and responsibility for our own care.
Alright, thank you.
Thanks for your time.
Is that it?
That's it.
Jeez.
Mark?
So you can
Some-
suggest questions for them.